Bismillahirrahmanirrahim. Hello everybody. So a 29-year-old woman gravida 1 para 1 is evaluated due to recurrent fever on day 5 after a cesarean delivery for arrest of descent after a prolonged induction of labor. Gentamicin and clindamycin are administered for fever on post-operative day first. Ampicillin was added on post-operative day 3 as the patient continued to be intermittently febrile. Today, she has no nausea, vomiting, hemoptysis, dyspnea, hematuria, dysuria, or diarrhea. Temperature is 39 still. Blood pressure is 120 by 80 and pulse is 108. Oxygen saturation is 96%. The lungs are clear to auscultation bilaterally. Breast examination show full, slightly tender breast with no erythema. Abdominal examination show mild bilateral lower quadrant tenderness to deep palpation. And incisional with serraginous drainage but no erythema or induration. Pelvic examination revealed a non-tender uterine fundus that is below the umbilicus. Examination of the lower extremity showed no swelling, tenderness, and erythema. Hemoglobin is 10.8 gram per deciliter. Urine lysis is normal. CT scan of the abdomen and pelvic show no abscesses or fluid collection. Which of the following is the most likely diagnosis in this patient? Acute pyelonephritis, aspiration pneumonia, incisional infection, postpartum endometritis, pulmonary embolism, septic thrombophlebitis. So first of all, this patient came to us at 29. This patient having age 29 year, and she having a cesarean delivery, from which she having a persistent fever that is not responding to multiple antibiotic therapy because she received gentamicin and clindamycin. On examination, she having bilateral lower quadrant tenderness to deep palpation. So here the diagnosis of this question is septic thrombophlebitis. The diagnosis of this question is septic thrombophlebitis, and here the correct option is choice F, septic thrombophlebitis. Why the choice F? Because this patient presentation is consistent with septic pelvic thrombophlebitis, a complication associated with either pelvic surgery or the postpartum period. Septic thrombophlebitis is a thrombosis of the deep vein of the deep pelvic or ovarian vein as seen in this patient. Bilateral lower quadrant tenderness that become infected causes endothelial damage from infection or a trauma during delivery. Persistent fever unresponsive to broad spectrum antibiotic therapy is a negative and a negative infectious evaluation suggests septic thrombophlebitis. Treatment is with anticoagulation and broad spectrum antibiotic. Come to the incorrect one. Why the choice A is incorrect? Acute pyelonephritis present with costovertebral angle pain and dysuria, neither of which is seen in this patient. In addition, this patient has a normal urine lysis Choice B, aspiration pneumonia. In addition to fever, aspiration pneumonia typically present with dyspnea, low oxygen saturation, and crickles in the lower lobes on pulmonary examination, none of which is present in this patient. Choice C, incisional infection. Incisional infection can cause fever but present with incisional pain, erythema, and induration. Choice D, postpartum endometritis. So endometritis is the most common cause of fever associated with uterine tenderness, and purulent loci are also present. Endometritis usually respond to antibiotic therapy. Choice E, pulmonary embolism. So although pulmonary embolism can present with fever, patients typically also have dyspnea, hemoptysis, pleuritic chest pain, and low oxygen saturation, none of which are seen in this patient. Come again to choice F. Why the choice F is the correct one? Because this patient having cesarean delivery from which she developed persistent fever, which is not responsive to any of the antibiotic therapy. On examination, she having bilateral lower quadrant tenderness to deep palpation. So here the diagnosis of this question is septic thrombophlebitis. The most common cause of septic thrombophlebitis is previous pelvic surgery or cesarean delivery, because the pelvic vein or the ovarian vein may become infected. So that is the cause of persistent fever, which is not responsive to antibiotic therapy. So the treatment choice for septic thrombophlebitis is anticoagulation and broad spectrum antibiotic. Thank you.